Okay, so this is how to open up a sterile field and how to prep for wound care. So first of all, before you prep for wound care, you're going to first see exactly what you're going to be collecting. You can either check that on the wound care flow sheets or previous progress notes. They can say whether what kind of packing they've done, if they've had any, what kind of dressings they've used. As well, another option what you can do is with clean gloves. You can also gently take off the dressing and see what is underneath to be able to assess what it is without actually touching anything underneath to contaminate it. And then you'll place it back in to be able to collect all your supplies. So first what you're going to do is you're going to get your dressing tray, and you're also going to read the label to make sure that you have everything that you need. So we have the tray, the sponges, the forceps that we need. We would have the garbage bag along with the towel and another forceps as well. Perfect. Along with that, you need to make sure that you have your saline. If you are using certain kits, they will have saline inside there already, but majority of kits will not, so you will have to do that. Now with your sterile dressing kit, when you do take it out of the bag, make sure that your area is properly cleaned. You will use either a cavity wipe or an Excel wipe to make sure it is sterilized. And then when you are putting your dressing tray, you're going to make sure that whatever area you are going to do, either to your right or your left, is the patient's head. We are not going to have it to behind her back because we want to make sure that even when we are doing our dressing kit, we can have a look at the patient. Okay, so with the dressing kit, when you open it and you are separating it all together, you do have a 1-inch border around the entire area. When you're first opening it up, you want to make sure that it is properly stretched out and it does not fold back in, because if it does fold back in, it is considered contaminated, and then you need to start the entire process again with a new kit. So first you would open the top and then the two sides, and then before you open the bottom, you're going to notice that as you lift up, there are going to be forceps there for you. These are going to be your transfer forceps. At the moment I don't have the plastic ones, but I'm going to use these metal ones. So as you pull out, what you can do to expand your area is you're going to put the forceps as they are sterile into the area. That's going to be past the 1-inch border because it is sterile to sterile. And you can make it a proper square area, and then you can just make sure it's flattened out. And then finally what you can do with your tray is put it to the center. Now what you can do with these pieces is you can make sure they're placed out within that 1-inch border. So you want an inside to keep it sterile. But with these forceps, I know I'm going to be using them to make wontons. So we are going to put the handle inside the 1-inch border. And then you would have also the 4x4 gauzes in here along with the 2x2s. Depending on what kind of wound you're looking at, you may need to get extra ones or other kind of supplies. And what you could also do is you would open the packages up. Best preference is what to do is you fold it outside and then you hold onto where you get your transfer forceps, pick it inside without the outside touching it, and placing it into your sterile area. So then what you're going to have to do is, I'm going to pretend this is my saline. So what you would do is you would open it up and you would pour it into the area, making sure that you do not get any of the saline onto this area itself, as if it is, again, it is contaminated and you have to start the entire procedure over again. So what you're going to do now is we're going to make wontons. So we'll get a single piece. We'll do one example. So we have our wonton here. Best example is to get one corner, put it to the center. The other two side corners we'll put to the center as well. And then once you grab onto here, you're going to grab this end piece and you're going to wrap it around and squeeze out any excess moisture. So as you can see, there's a few drops that are going out. This makes sure that it is damp but not wet. This is especially important if there's anything that you don't want to be soaked within saline, such as things like if it's a cavity area that's open to places such as the trachea or things like that. It's really important that you're not getting any kind of you're not getting any saline within there, as they can aspirate it and you can cause pneumonia from there. So from there, after you do that, your wonton. You can put the last one in there, and your wonton is ready. So with here, you can then cleanse the area with only this area, and then after you cleanse with one way, you can then discard it into your garbage. Now after you have set up your garbage, so let's say I have a garbage bag, you would make sure you take it out of that sterile area, and you would place it into your triangle. So the triangle, if my patient is, say, to my right side, I would make sure that my garbage bag is below, maybe towards his feet, because this would make sure that I am within the triangle area. So then if I am turning towards the garbage, I can still see my sterile area and I can still see the patient. Another thing we're going to have to make sure on is not to be reaching over our sterile area. If we do reach over with anything, especially if it's contaminated, again, our area is completely contaminated and we have to start over again. Finally, what you will notice in your kit is you will have this sterile dressing, sterile drape. This is able to extend your area if you do need to extend your sterile dressing. So with this one, you would be able to take it apart and place it down. If you do have sterile gloves, after you place it on, you'd be able to pick it up, and by folding it inwards, you can then place it in without contaminating your hands and keeping them sterile to be able to expand your sterile field rather than just this small area. Right? And that is how to open a sterile dressing kit and how to prep for wound care.